Hey, super exciting. We're at 2:15 p.m. here at Digital Health Summit San Diego with Dr. Mylene Yao, who's with Univfy.
Univfy Inc. is the name of our company. It stands for recognizing that each fertility patient has a unique clinical profile, and we want to give each patient predictive information that is most meaningful to her.
How did you get started with all this?
Well, we started this when we were doing an academic research project at Stanford University.
Oh, cool.
I was assistant professor there in the Department of Obstetrics and Gynecology and teamed up with a really amazing team of statisticians. My co-founder, Professor Wing Wong, is a professor in the Department of Statistics and has made great contributions in the area of biostatistics, genomics research, and Bayesian statistics. And we also have Dr. Bok-Young Choi, who really started this project with us back in 2005 when he was graduate student in Dr. Wing Wong's lab. And now Dr. Choi is our VP of Statistics and Technology. And and we've also built up the team to be able to do a lot of really sophisticated data mining and to build prediction tests that can help fertility patients make sense of the data that they have to help them make decisions.
So you take in all kinds of data from these tests, and then what's the secret sauce? Like, how do you?
Yeah. So the kind of information we take depends on what stage the patient is in. For example, we have a product called Univfy Pre-IVF, and that helps patients who have never had IVF. First of all, just to take a step back, IVF stands for in vitro fertilization, which is the most effective treatment in infertility for many men and women who are going through this diagnosis. And Univfy Pre-IVF is for patients who've never had IVF and want to know what are their chances of success of having a baby if they were to go through IVF.
Oh, okay.
Yeah, and this treatment is very effective, but unfortunately in many states it's not mandated to be covered by insurance. So patients have to pay out of pocket often $10,000 to $20,000 per treatment, and so patients really want to know what are their chances of success when taking on this. And we have a way to gather their information such as age, body mass index, which is based on your height and body weight, and also reproductive history, some laboratory tests, sperm count, and we've taken all this information in an online questionnaire that patients can do in the privacy of their own home, and then they can just submit the test, which is an online, and they can get a report directly to them.
So before, what would happen?
Normally a patient would, there are two ways for them to get information. Of course, the best is, or what we always encourage patients to do, is to still see a doctor and see a fertility specialist. However, with the amount of data that we're having these days, it's very difficult to kind of sort it all out to give an accurate prediction for each patient because everybody's situation is different. So a fertility doctor is probably going to be able to give a range, such as, your chance is probably somewhere between 30 and 40% to have a successful treatment because you have certain factors that are really going for you, but you have certain factors that may not be, so favorable. And it's very hard to tease apart and to put numbers together like that, and that's where we come in. And our test provides a way for doctors to be able to have some very accurate numbers to conduct this counseling with their patients. So we encourage patients to get their reports printed after they've done it on their home computer and bring it in to see their doctor with the report. So that's one way to use to use this information.
So Dr. Yao, what is your vision for the company in the long term?
Well, in the long term, right now, there are many of these decision points that patients are facing when going through infertility, and we're developing prediction tests to address each one of these points. But, gradually, we're also going to maybe work with a broader age groups, so even beyond the infertility or IVF treatment. And we're going to let the company evolve, and really also listen to our patients and see what kind of help they need and then respond to that.
And what excites you about this event? Who are you trying to connect with, and what kind of sessions are you interested in?
So this Digital Health Summer Summit has been really incredible. I've met with some really creative individuals from different companies that are doing very exciting stuff. I think the main theme I'm kind of getting from hearing all the talks is that there's one main focus that all the companies here are doing, which is how do we deliver to the patient what he or she needs? Whether you're talking about diabetes, cardiovascular diseases, or how to build the right fitness regimen, listen to the patient, listen to the customer, and build a program that works for them, that fits in with their lifestyle. And that's pretty exciting because that's what Univfy is about also. And so I'm really, getting a lot of camaraderie here. Yeah.
So you can connect with your company. What's your website address?
It's www.univfy.com. And we love to hear from you, whether you are talking to us about fertility or about other areas in medicine. We're also very interested to, work with people outside of fertility because we have developed some really streamlined and sophisticated data processes that we can bring to other disease markets as well.
Great work. Well, thanks so much for being on the show.
Well, thank you, Tim. Good to be here.